In blood transfusion services, safety isn't optional, it's essential. At the heart of this, safety is a quality control ensuring that every test, reagent, and result meets the highest standard. Welcome to the introduction video of quality control in TTI, where precision, accuracy, consistency protect lives every single day. So today video is all about the quality control of TTI, and let's get started. So as per the DNC Act of India, there are five mandatory tests for screening of the blood donation. So first is the anti-HIV 1 and 2 antibodies, anti-HCV antibodies, hepatitis B surface antigen. For syphilis we have a test, and for malaria. Why we require quality in TTI testing? So as we know that the blood is a source of TTI and quality is essential to prevent the TTI. Lack of quality can result either in TTI or wastage of blood. TTI testing is dependent on number of variables which need to be controlled. Quality control of TTI. The QC of TTI lab denotes that consistent measures undertaken for each TTI assay to ensure that the test should work accurately as per the limit of the test to produce valid and acceptable result. So this indicates that the test should be valid, consistent and reliable. Implementation of QC for TTI. How we can implement? We can implement QC for TTI by establishing written policies and procedures, designing forms and flowchart, select high quality control, perform statistical analysis, set the target values, establish LJ charts, routinely plot control data, establish and implement troubleshooting and corrective action protocols, establish the main system for the documentation, and by training our staff. How we can establish written policies and procedure. The SOP for TTI lab should be developed in the blood bank as a set of instruction and to be followed at all the time by the staff. So it includes that the reception and handling of the sample, performing the assay, use and maintenance of ELISA washer. Here we are talking about the ELISA because most of the blood bank uses ELISA for their TTI testing. But in other blood banks, some other machines can be used. So we will be using their maintenance, how to perform and at what interval need to be performed. So here I'll talk about the ELISA. So we have to use and maintain the ELISA washer, ELISA reader, and we have to use and maintain the pipettes, issuing of the result, retrieving and disposing of positive donation, cleaning and decontaminating the labs. We have to design the forms and checklist. So blood bank should develop the checklist worksheet for each assay detailing all the required action in the correct sequence. And after screening, this complete worksheet becomes the quality record of that batch of testing and should complete the quality circle providing its traceability. Assay used for the TTI screening. The assay most commonly in use are designed to detect the antibodies, antigen, or the nucleic acid of that infectious agent. So there is no technology currently that exists which can detect all the window period of that donation. In spite how efficient screening assay is, some residual risk of the disease transmission will be there. There are a number of factors that need to be considered in selecting the most appropriate assay. Resource available, including the finance, staff, their expertise, equipment, consumables, and the disposables. So each assay has its limitation, which need to be understood and taken into consideration when we are selecting the assay for our lab. Now, how we can select the assay? So, two factors important for the selection of the assay is sensitivity and the specificity. For screening of blood donation, both these factors, sensitivity and specificity, should be the highest possible or available. So sensitivity is the probability that the test result will be reactive in an infective individual, and the sensitivity of an assay is therefore the ability to detect the weakest possible positive sample, whereas a specificity is the probability that the test result will be non-reactive in an individual who is not infected, and this assay is having the ability to detect all the non all the false positive or non-specific positive. How we can calculate the sensitivity and the specificity of an assay? So we have to create a 2 by 2 table. In the first row we have to write the positives assay result, and in the second we have to write the negative assay result. Now which are true positive, like which are showing the true positive, that will be put in the A, false positive in the B, and false negative in the C column, and the D will show the true negative. So we have to compare the result with the sensitivity given in the manufacturer instruction. For the sensitivity, it will be the calculated as the how many we are getting in the A box divide by A plus C into 100%. For specificity, it is D, that is true negative divide by the false positives and true negative into 100%. The sensitivity and the specificity of the assay are generally inversely related. So that means if the sensitivity is increased, the specificity will decrease, and vice versa. Predictive values. Predictive values are another way of looking at the performance of the assay. That is, what can be expected from that assay. So the positive predictive value and the negative predictive value, these two are the measure how actual assay in a blood bank is performing. So the positive predictive value, it shows the positive result being true positive, and the negative predictive value is the probability that will show that the negative result is being true negative. Again, it is calculated in the same way. It's the last slide for today's video. It's the essential elements that governs the quality of TTI. I'm just naming that all, and in the next video we will be discussing each and every one of it. So the essential elements are quality of the specimen used for the testing, quality of the kits, quality and calibration of equipment use of SOP for testing, type of control used while we are doing that test, interpretation of result, validation of result, record keeping, and the training of staff in the SOPs. Like, share, and subscribe the video.